Greetings dear viewers. In this video, I would like to explain about the Ebola virus, its transmission, structure, pathogenicity, clinical symptoms, laboratory diagnosis, treatment and prevention. I am Dr. M. Manikandan, Assistant Professor from the Department of Microbiology, Sacred Heart College, Tirupattur. History and Introduction. Ebola virus was named after the river in the Democratic Republic of Congo where it was initially discovered. Ebola is a rare but life-threatening illness. Ebola virus was discovered in 1976 when two severe epidemics of hemorrhagic fever occurred in Sudan and Zaire. Subsequent outbreaks of Ebola hemorrhagic fever have occurred in Uganda, Congo, Gabon, Sudan, Ivory Coast. According to the World Health Organization, 28,616 suspected, probable and confirmed cases with a total of 11,300 deaths were recorded in Guinea, Liberia and Sierra Leone. Mode of transmission of Ebola viruses. These viruses may be endemic in bats or wild monkeys and can be spread to humans and in between humans. Fruit bats of the Pteropodidae family, including the species Hypsignathus monstrosus, Epomops franqueti, and Myonenterus torquata, are believed to be the natural hosts of Ebola viruses, with humans and other mammals serving as accidental hosts. Contact with the animal reservoir or direct contact with infected blood or secretions can spread the disease. Accidental injection or use of contaminated syringes may also transmit this infection. Healthcare workers who are tending the sick and monkey handlers may be at a huge risk of this infection. Structure. The Ebola virus belongs to the Filoviridae family and it is a filamentous virion with a enveloped structure, contains a linear non-segmented negative sense single-stranded RNA, and the virus measuring 18 nanometer in diameter and 800 to 1400 nanometer in length with 15 to 19 kilobases of RNA genetic material which encodes 7 different kinds of proteins. Structural proteins associated with the nucleocapsid are the nucleoprotein NP, VP30, VP35 and the polymerase L protein. The nucleocapsid is encapsulated by an outer viral envelope originating from the host cell membrane with characteristic 10 nanometer long viral glycoprotein spikes that initiates attachment to the host cell surface receptor. This is the structure of an effective virion, which is filamentous in nature with enveloped linear non-segmented single-stranded negative sense RNA viral particle which has a transcription factors BP30, polymerase cofactor BP35 and polymerase L proteins. The envelope proteins contains the BP24 and the matrix protein BP40. Genome. The important genomes encodes for 7 proteins which includes GP transmembrane glycoprotein that helps in attachment, NP nucleoprotein which is necessary for capsid assembly and packaging, BP24 which is an antiviral inhibitor suppresses interferon production in the host cell, VP35 which inhibits interferon production or antiviral response to double-stranded RNA. Next is the VP30 which acts as a transcription and anti-terminator. Then VP40 which maintains the structural integrity of the virion which is necessary for capsid assembly and budding At last, the L protein, which is involved in the viral polymerase. Replication. After the viral transmission into the host cell, the viral entry is mediated by attachment of virus to host cell surface receptors like DC sign and DC sign or receptors through the viral GP glycoprotein. The virus then enters into the host cell by macropinocytosis process or clathrin mediated endocytosis process. The viral GP glycoprotein 1 interacts with the host cell membrane protein and promotes fusion of virus membrane with the vesicle membrane. And then the viral capsid along with genetic material is released into the cytoplasm. Then the sequential transcription takes place inside the cytoplasm, that is the viral mRNA synthesis starts in the cytoplasm. Viral protein 30 is an important transcription activation factor for viral genome transcription, while viral protein 24 is an inhibitor to this process. The replication starts by binding of RNA-dependent RNA polymerase enzyme to the leader sequence on the encapsulated negative sense RNA genome, that is the original genome. The antigenome, that is the complementary positive sense RNA genome, is synthesized during the replication and is used as the template for the further replication process. The ribonucleic acid interacts with the matrix protein VP40 and buds via the host cell endosomal sorting complex, which is required for transport. This takes place near the plasma membrane, and the releasing of newly synthesized virions will take place, and the newly synthesized virions will cause infection in the neighboring cells. Pathogenesis. The Ebola virus enters into the host through basic entry paths. It can enter through mucous membranes, broken skin, or by parental transmission. The viral particle is capable of binding to these membranes of every human cell. The entry of the cell is controlled by a viral glycoprotein that is responsible for binding the virus to the host cell surface receptors. The inflammatory response induced by the viral infection is so drastic that it begins to cause damage to the host cells. By deregulating the cytokines, the virus is able to spread rapidly throughout the host body. The Ebola virus has the capacity to inhibit the host cell synthesis of proteins that inhibits the viral infection by three ways. The first is the production of VP35, a protein which is capable of inhibiting the synthesis of specific interferon proteins. The second protein production, VP24, also disrupts the interferon response. And the third way, the virus that is capable of defending itself from the antiviral response is through the glycoprotein inhibition of tethrine expression. When the virus spreads throughout the body, one of its target organ or the hepatic cells or liver cells. The Ebola virus can induce hepatic cell necrosis, which can result in multiple outcomes inside the host. When the virus starts destroying the hepatic cells, the liver, unable, unable to synthesize enough coagulant proteins, which allows the hemorrhagic conditions to happen. The necrosis also shut down the liver functions, rendering the liver becomes useless to the infected human. Other important organs that undergo a similar attack from the virus are the spleen, thymus, and lymph nodes. Clinical symptoms. The incubation period is around 2 to 21 days. The Marburg and Ebola viruses are the most severe causes of viral hemorrhagic fevers. compared to other kind of hemorrhagic infections in humans. The initial symptoms found in an infected host is the flu-like fever, headache, muscle pain, chills, fatigue, sore throat, nausea, vomiting, and diarrhea occurs within a few days. A rash may also be seen to develop. Later symptoms found in the infected person is the hemorrhagic condition from multiple internal organs, that is internal and external bleeding, vomiting or coughing with blood, rash, dysfunction of kidney and liver also seen. Death occurs in as many as 90% of the infected patients. This is how an infected person looks with the external bleeding and also multiple rashes all over the body. Laboratory diagnosis of Ebola virus. The specimens need to be collected or blood or body fluids, semen, oral swabs. Handling of these Ebola or Marburg viruses requires level 4 isolation procedures that are not routinely available. Findings include low white blood cells, low platelet counts, elevated liver enzymes. Infected cells have large eosinophilic cytoplasmic inclusion bodies. The test that can performed to identify the virus is the ELISA or immunofluorescence that detects the presence of IgG and IgM antibodies. The other tests include serum neutralization test, molecular level identification requires RT-PCR, and the electron microscopic technique identifies the morphology of the Ebola virus. The virus can be cultivated in animal by inoculating into a guinea pig, which may be necessary to recover Ebola virus. And it can also be cultured in cell lines such as Vero and MA104 monkey cell lines. And in these cell lines, we can detect the viral particles in the eosinophilic inclusion bodies. Treatment. The treatment majorly includes the rehydration with oral or intravenous fluids, as there is much amount of internal and external bleeding seen. The antibody containing serum and interferon therapies may also be performed on the infected individual with serious consequences. The potential treatments include blood products, immune therapies, drug therapies, which is being evaluated. To prevent this infection, good hygiene should be maintained in our environment, and the environment must also be kept clean. Prevention. Some of the methods used for prevention of the Ebola fever are rapid quarantine of suspected infected animals. These animals should then be buried or burned promptly, which is found to be infected by the Ebola virus. Handling all animals and their wastes with the proper gloves and other personal protective equipments. Cooking animal products like meat and blood should be thoroughly cooked before eating. And the animal handlers or the healthcare workers must regularly perform the hand washing techniques. Sanitation and sterilization procedure should be conducted on the environment and also over the used instruments. Identification and isolation of infected human individuals from the community should be performed to prevent the Ebola viral infection. Dear viewers, thank you for your patient listening, and kindly subscribe to our channel to encourage us, and comment your suggestions in our comment section. Thank you.